on, thank you. Well, wanting to start a family can be an exciting but anxious time, although conceiving isn't always easy or even possible for some couples.
In tonight's Health U, Intisar Faulkner is sitting down with the doctor to discuss what women looking to get pregnant need to be aware of and focused on.
That's right. It's a tough reality that no woman looking to become a mom wants to face. But what are the causes and signs of infertility, and when should you talk to your doctor? I'm joined by Dr. Nancy Sarmiento from Carolina Women's Physicians of Lexington Medical Center to share more about some common causes and some available resources for women looking to get pregnant. So thank you so much, doctor, for stopping by.
Thanks for having me.
Now, this is a really touchy subject, but it's also a very important subject. So first, how long does it usually take for a woman to get pregnant?
So in the average couple who has been trying with regular intercourse, normally within the first month you have about a 25% chance of conceiving. You take it up 6 months, it's about 70% chance, but in 1 year, about 95% of couples can conceive.
And at what point now should women start either noticing signs or go to their doctor?
So that's where age kind of plays a role. So 35 is kind of that magic number that a lot of women get nervous about. So if you're under 35 and you've been trying consistently for a year with no success, at that point we would say, go get evaluated. If you are over the age of 35, nearing 40, we want to get you in and get you seen by a specialist as soon as possible if you've been kind of trying for those 6 months and nothing has happened yet.
And you know, I'm so glad that we're talking about this because, as I mentioned, it can be a touchy subject, but how common is infertility and what are the causes?
It's so common and it's such a stigma because women don't like to talk about it because it's very hard to go through it. But 1 in 6 couples go through infertility, so that's 16% of couples. And so a lot of people don't talk about it, you don't hear about it, but it's very important for people to know that they're not alone. The biggest causes, so when I have a patient who comes to see me and they are just having general questions, is from a woman's perspective, I want to know, are you having regular cycles? And I think that's the biggest #1 thing to look out for. If you're using period trackers, if you have any other resources or any abnormalities that you're seeing in your periods, that's what we want to know as physicians. That's the first step we take. We want to know about your history, your partner, any significant surgical history you might have that could be affecting it. The biggest thing though is ovulation, because if you are having regular periods, that means you are ovulating every month and you are releasing an egg, which is ideally what we would want. So ovulatory dysfunction is like the #1 cause. Then we have things like something could be going on with your uterus. So you could have fibroids or polyps or uterine adhesions that we haven't been seeing. That's about like 20% of the causes. And a lot of people don't realize that men also play a role in this. So we also want your partner to be involved in this evaluation. A semen analysis is very important in your initial evaluation because, we don't want to do everything from the woman's perspective and then kind of ignore their partner as well. So those are the 3 biggest things. Usually men play a 30% role in the infertility evaluation.
And I'm glad you touched on that because that is a common misconception, especially I'm sure for a woman who is going through this feeling like it's my fault, this is on me, but it is, a partnership and men do play a role in that as well.
Yes.
Talk about once a woman goes to the doctor's office, that test that the OBGYN will perform.
So there's a couple things that we'll do. So the first thing, like I said before, is I will obtain a very thorough history and physical. I want to know about your cycles. Then after that, I'll do a couple of hormonal labs. So we can test your TSH, which is your thyroid, because that can have a big effect on your menstrual cycle. There's another test called an FSH, the follicle stimulating hormones. That's what's causing your follicles to release those eggs and grow. That can let us know how old your eggs are, per se. We see that number increasing as you age as well. Then the big test out now is the AMH, the anti-Müllerian hormone, and that kind of lets us know how many follicles or eggs you have available in your body. So that's like the biggest lab work that we'll start with, and then we can do a transvaginal ultrasound to kind of take a look into your uterus, see what's going on there. There's an X-ray dye test called an HSG, which will let us know, are your tubes open? Because if your tubes are blocked because of a history of maybe pelvic infections, that's something that we want to evaluate then and there. So really the initial evaluation is a bread and butter, like, let's see what your cycles are doing, let's check some lab work, and then maybe do some imaging as well.
Also, could you share what tools might be available for women to use if they want to track their fertility?
So lots of apps nowadays are available. I love using like Premom or Flow. These are all apps that will kind of let you input exactly when you start your cycle and when you end your cycle. And it will let you track also your ovulation. You can pair these apps with something called ovulation predictor kits when you are, really trying to see when you're going to release an egg to optimize your chances of conception. And it's just a little urine dipstick that you do. You take a picture with the app and it'll tell you what your peak is, as in like when you will hopefully release the egg, because that egg is good for essentially 24 hours. So you can time that intercourse appropriately. So I think using apps is actually very, very beneficial nowadays, because patients will come see me and I'll say, let me see your menstrual cycle schedule, let me see your app, and that helps me as well.
Absolutely, a way to log it just right there on your phone.
Yep.
So talk about when you would refer a woman now to a fertility specialist and some of the treatments that they might provide.
Yeah, so if you come to me and you're around the age of 40, for example, that isn't automatic, like I'm gonna send you right away, because I want to give you the best options possible. Now, if I do your basic lab work and your evaluation and I find abnormalities such as like you might need a surgery if you have polyps or fibroids, sometimes a generalist OBGYN like myself can take care of that. But if there are issues, so a reproductive endocrinologist and an infertility specialist will deal with hormonal issues. If, for example, your FSH is very, very high, which can mean you are going into early menopause, that's something that I want them to kind of step in right away and do that. So once you see an REI, at that point they're gonna discuss a couple of things, whether it's doing injectable medication to cause your body to ovulate if you're not ovulating, either with oral medication or injections. If, for example, it's a partner issue, so your partner's semen is not as adequate as it can be, they can do something called intrauterine insemination. So they will take that semen and place it inside your uterus to kind of give you the best chances. And then of course you have your IVF, which is kind of like a conglomerate of all those things. So you will be they'll induce ovulation with medication, they will remove those eggs from your body, fertilize them with your partner's sperm, and then go ahead and inject them into your uterus. So it's kind of like a very piecewise, very long process, but very effective process if you get to that point. So if you come to me and I think you're under 35 and you've been trying for a year, we've done your lab work, we've done timed intercourse and done ovulation predictor kits, and still nothing is happening, at that point I would suggest seeing a specialist.
Dr. Sarmiento, thank you so much. Again, I feel like this information is going to help so many women through their journey. And again, it is a touchy subject, but it's something common that we should talk about. So I'm glad that you were able to share all of that information with us. And if you have any concerns, you can schedule an appointment. Just head to carolinawomensphysicians.com for more information.